So we are going to go over some of the upper extremity exercises for the restorative program. So I'm going to go through shoulder, elbow, forearm, wrist, digi, all of those things, because one person or another that's on restorative will have one of these exercises. So the first one I'll go over is shoulder flexion. They can see me. Okay. So you will support the elbow and come up just to 90 degrees and hold. It'll say on the sheet probably how many reps. It'll probably be 2 sets of 10, something along those lines.
You don't want to go past 90?
Or you could go past 90.
Yeah.
I guess it depends on who it is.
Right. But it will say to 90 for those.
Okay.
Right.
Yep. A lot of people can't go past 90, like some of the strokes.
Right.
So, okay. If you want to scoot over, Amy, those for the abduction, adduction. So that's kind of coming out. You can have them do as much as they can for themselves, but you'll have them come out just kind of like they're making a snow angel. You'll come out, go as far as they can tolerate, and then kind of hold for a couple seconds to make sure they feel that stretch. We'll come back down. So the motion of going away from the body will be abduction. Coming to the body will be adduction, like you're adding it to your side. So then I'm going to have Amy sit up at the edge of the mat. So what that shoulder extension would look like.
Shoulder flexion.
Shoulder flexion. You're coming up. Back down, and then shoulder extension. You're having them come back. Hold. Okay. Abduction. Or some people will have the elbow back, will come up like this. Okay. So then elbow flexion. It'll just be kind of, I call them nose touches when I'm talking to patients, coming up towards their chin or their nose. You can have them hold. Forearm supination, pronation. So pronation, we're going to supination. I remember that, like you're holding a bowl of soup. Just coming back and forth. Have them hold it. It's easy on someone like Amy, but someone who has a stroke, it's really important to get a good stretch in there. Wrist, extension, flexion. Then there's a couple with the fingers. So I know I have somebody on restorative doing opposition. So you're touching each finger to the thumb.
Actively or passive?
It depends on who it is. So this is what it will look like.
So if it says active, that would be what Jess is doing.
Yes, it's what. Yeah, they will be doing it for themselves. But if it's
passive,
then you're gonna. I don't think I have anybody doing passive, but yeah, you'll be literally just bringing them to each finger to the thumb. I have some people like making the fist. What else do I have them doing? Abduction. Okay, so there's a sheet on there that says finger spreading. That's add an abduction, just kind of like what we did with the shoulder. Abduction is spreading the fingers. So spread the fingers, bring them all together is adduction. I think that's it.
So if you're abducting each finger, it would be like you're spreading apart these two. Then you're done with these two, and then you spread this one apart. So it's most of them, if it's passive range of motion, they cannot do it on their own. So then you're going to individually do between each finger. Right?
Yep.
Oh, shoulder shrugs.
Oh, shoulder shrugs. That's another one. So, and I wonder if I have shoulder squeezes right.
I don't think so.
No?
I haven't
Okay.
seen that.
So the shoulder shrugs, you're going to ask the patient to essentially shrug their shoulders, like, you know, when somebody asks you a question you don't know.
And something like this you cannot do passively, so it would have to be actively, which means that the patient or the resident would do it on their own. So that would be bring their shoulders up and then relax them. And then up and then relax them.
Okay. I don't think there's anybody with squeezes left.
No.
Okay. I think that's it.
Okay.
Okay. So then we'll go to...
Now we're going to do the lower extremity.